So today we're going to discuss the impact of adult learners on your learning ability. So an adult learner is one who's 21 and older, so that's all of us. And you might have suspected this, but we learn differently than the way we used to, especially when we were in high school and college. As an adult, we have what I call the new 3 R's. The 3 R's traditionally were reading, writing, and arithmetic. But for an adult, you have to relearn the material. The material has to be reinforced in order for you to retain it. Now, adult learners need to be accountable for their learning, and I think this is important in your board exam process. You need to be active and engaged. You can't be passive in the process. Now, here are some learning facts, a little bit depressing, but I think it's important for you to understand. You forget 40% of what you learned in just 20 minutes. So if you reviewed some material today, try and review it again tonight. Just briefly review it. You forget 77% of what you learned after 7 days or 1 week. Again, repetition is important. Try and review some of that same material within 3 days. And by review, I don't mean that you have to scrutinize and study it the way you do the first time, but literally just reviewing to be refreshing. This is especially important for those of y'all taking your mock written exam. I suggest you literally take the exam the day after the course. You don't need to study. Your learning is at your peak. The review is at your peak. You've been at the course for 5 days. The ideal time to take the test is immediately after the course. And then finally, you forget 90% of what you learned in just 1 month. So again, repetition, repetition. So our strategy at ABC is what I call the snowball effect, because we, again, want to keep that ball rolling with the repetition. At the course, we stick with the same topic. We don't jump from one topic to the other. We use the same speaker, so that way there's no acclimation to the speaker. You get oriented to that speaker immediately, and we just give the right amount of time for a lecture where there isn't an arbitrary time frame. New materials need to be repeated a minimum of 5 times in order to retain 70%. So our strategy is we give you written objectives. We have the test topic manual, which is something that you can use both during the lecture and especially after the lecture. And each lecture has accompanying written questions that can be reinforced no matter which exam, whether it's an oral or written. Oral defense tips. As adults, we need to hear the learning presentation in a variety of manners. So even if you're doing a written test, to then view the oral defense tips reinforces a different type of learning, and again, you're more likely to retain that. And we also give you the exam focus during the lecture with both verbal cues saying this is high yield, and also they're highlighted accordingly on the PowerPoint. Now, there are 3 typical learning styles for adults. A visual learner is one who processes information best when it is visually illustrated or demonstrated. An auditory learner, as you would expect, one who processes information best when it is spoken and they can hear it. And a kinesthetic learner who processes best when it's information that can be touched or manipulated. As you might suspect, many of us have a variety of all 3, but we tend to lean more to one than the other. I'm just going to briefly review each of the 3 styles. The visual learner is somebody who typically sits in the front because they want to see it. They take detailed notes in colors and stickums because as they view those different colors and stickums, that reinforces that particular material. They oftentimes need to close their eyes to visualize or remember something. This is particularly important when reviewing a procedure. Videos naturally enthrall them. They learn best from that, and they enjoy illustrations and presentations that use color. So our strategy for a visual learner is we oftentimes will have models and study aids that you can see. We use the PowerPoints as the handouts, so as you're seeing the PowerPoint on the screen, when you go back to view it, it's the same presentation. You love the audience response system because you can see the responses going in. The course DVDs actually show the speaker in the corner of the DVD, so you can watch the speaker as well as simultaneously see the PowerPoint. Now, how should you study? You need to see it. So what can you do to see it? You can rewrite your notes. You can fill in the test topic manual. Before you answer, you can make a drawing. If it's an oral exam, you can jot out some visual prompters, such as a mnemonic. And before you answer, see it in your mind. So, for example, describe the course of the ureter. Close your eyes for a minute. See the course of that before you articulate. On the written exam, your pencil, even though you're on a computer, you will be giving a notebook and a pencil, should be active and not just simply a placeholder. Write out your prediction, draw the concept, and actively engage in crying out for that process of elimination. On the oral exam, the FAQs and the test topic manuals, write it out first, then articulate it. Structure cases, same things. But again, as you become more proficient, you don't want your writing out and visualization to slow you down, and it just takes a little practice to get the hang of that. Visualize that concept before and while you're speaking. On your case list, when you look at that patient, at that case, see that patient before you. Again, use diagrams or illustrations, use Post-its or notes cards, and I suggest strongly that you video your mock oral. Now, what about an auditory learner? Again, someone who processes information best when it is spoken so that they can hear it. These learners don't need to sit in the front. They just need to sit where they can hear. They don't actually have to see the slides. They just need to hear that presentation. And they oftentimes will answer out loud during the lectures. So our strategy is, of course, is recorded audio so you can hear it. During the interactive written questions and answers, you can hear that discussion. Webinars are a fantastic source so that you can hear the presentation. When you're studying, don't read silently. Actually read out loud so you can hear what you're saying. You can even record your notes, and as you're driving and whatnot, you can hear that. Verbalize that concept out loud, and again, the course is recorded so you can hear those lectures. For a written exam, when practicing, read the question out loud, verbalize that prediction, and then talk out the process of elimination. Now, obviously, you can't do this in the middle of the test. That'd be a little bit distracting to your neighbor. But again, as you practice and become more proficient, then you can progress forward more quickly. On the oral exam, for the FAQs and the test topic manuals, verbalize those answers. The structure cases, read out loud. Oftentimes, you're given a choice if you want to read silently or have the examiner read it to you. This is where you would want to actually read that case. Oral exam tips are fabulous. You can actually rehearse them until you almost memorize them. Use your study cards as cues. Record a mock oral exam and listen to what you're saying. And again, the webinars are great. Finally, the kinesthetic learner process information best when it's tested or manipulated. It's important that you stay active in the process. Take frequent breaks when you can tell that you're getting distracted. Use hands and gestures when speaking, but not to the point where it is distracting. And again, you perceive best when doing. So really, any of the other study aids that we talked about will be great for the kinesthetic learner to actively engage. One point to note, especially for the oral exam, if you're asked to describe a procedure and it is something that you are unfamiliar with, say you're an MFM and they want to do the dictate a vaginal hysterectomy, well, get yourself into the OR and watch and participate as best as you can with that procedure, because seeing and doing is thereby believing. So keys to being a successful adult learner: determine your learning style. Set yourself up for success. Define a study schedule. Clear your obstacles. Make sure you've got the kids taken care of, your call schedule is taken care of, and you're not distracted. Your partners can cover for you. Your partner or spouse, significant other, again, set it up for the time that you can study. The 3 R's, again, you need to relearn, especially reinforce in order to retain. And the 4th R I'm going to add in there is revise your schedule accordingly. And absolutely practice, 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 whether you're doing both written questions or mock oral. So as an adult learner, again, embrace the new you and the way you learn and set yourself up for success.